Good afternoon. You have me, Stefan Lehman from Bedfordview in Edenvale newspaper, tracks and local media. Today I'm here with Dr. Mark Govender from the Baker Street Medi Centre. We're chatting a little bit about the COVID-19 virus, which has become a pandemic across the world, and we've seen over 100 cases reported in South Africa. So, Doctor, thank you very much for your time and your expertise. I really appreciate it.
Pleasure. Good afternoon, Stefan.
Thank you. And now, Doctor, in your opinion, are there any communities in South Africa which could be at greater risk to contracting COVID-19?
Yes, Stefan. Currently, internationally, the elderly patients have been the ones that have been biggest hit to the COVID-19 disease. But in general, we would think that any patient who is immunocompromised would be at risk. So it will be like the very young, the very old, like we mentioned, the immunocompromised, the patients with HIV, the patients with TB, some cancer patients, and patients with chronic medical conditions like heart failure, diabetes, and asthma.
Or maybe a cardiovascular problem.
Yes.
And now, so I mean, Doctor, besides age and viruses, do you think perhaps communities where that live in greater proximity of each other, they might be at risk of where property sizes may be smaller?
Yes.
Do you think that also plays a role in the spread of the virus?
Absolutely. So, our current strategy for the management of the COVID-19 virus is to promote a thing called social distancing, whereby we're moving people further apart, thereby reducing the transmission of this virus in itself.
Yes.
And they tend to find that in areas where there's high dense individuals,
Like an urban area, like
an urban area, you find that there's a lot more room for the transmission of the virus to occur. Like if you looking at yesterday's statistics, 61 out of 116 cases in South Africa is from Gauteng.
Yeah.
But you look at Gauteng in itself, it's the smallest province and the most dense,
most populated
yes. Place.
Because of the job opportunities in the province.
100%. So that just lends to the transmission of this virus.
Yes. And now, Doctor, what can community members do to try and minimize the spread of the virus?
Well, the President has outlined lots of those initiatives that we can do. Firstly, we've got to move away from contact with people. Right? So people come and shake hands, they hug, they kiss. We have to change our mindset as to how we do that.
Yes.
Right? Find another way of doing it. Then also is that the way we, our personal hygiene, washing of our hands, we need to wash our hands thoroughly and regularly we need to do that. Then we also need to look at the way we cough, the way we sneeze, make sure we do it into our bent arm, onto a disposable tissue that we throw away. We also look at things that we touch. Try not touching objects that are not necessary to be touched, like railings and things like that.
Or a light switch. Perhaps use a pen or a strong pencil to switch it on.
That's exactly, because the virus, they've said, can live in inanimate objects for up to 24 hours.
Yes.
So that's it. Other things that we can also do is transport. We've got to try to avoid buses, taxis, Ubers, try to avoid those things, minimize, I should say.
Especially in public transport where there's a lot of people condensed into a very small area.
100%.
Yeah.
Then we need to look at ways of, you've got to avoid shopping malls, restaurants, cinemas, you've got to avoid that.
Yes. And now, Doctor, I mean, we know South Africa relies heavily, a large percentage of the population relies heavily on public transport, such as buses and taxis, and also social public gatherings. And now, if one does find themselves in that situation, form of public transport, what advice would you recommend to them?
Well, so then you go to the right club. Ideally, if you're in an environment where you see there's someone sick or there's someone's coughing, you've got to stay at least 1.5 meters to 2 meters away from them to prevent, because the virus is transmitted by droplets.
Yes.
Yeah. So if you can find yourself a mask, put a mask on. If you can't find yourself a mask, maybe you try to buff, double layers of that there. And also if you can get a pair of gloves, try to put a pair of gloves on.
With latex gloves or any kind of gloves.
100%. If you can minimize that trouble, that would be prize number one, that would be the best.
Yeah. No, of course, I definitely understand that. And now, as a medical practice yourself, and as a place, as a premises where people with compromised immune system, and even possible people with the COVID-19 virus come to, I mean, what steps has your practice sort of put in place to reduce the spread of the virus?
100%. So when the virus started spreading, especially we were initially hoping that it wouldn't reach us, but that was obviously poor thinking. We screen our calls, patients that call in, we take measures to make sure that we're not accepting patients that have traveled internationally or patients that are acutely ill. I will screen the call first and decide if I need to do a test or refer them to a center that needs to be tested initially. That's one. Second is that when patients enter the practice, at the entrance of the practice, we have hand sanitizers. The front doors left open so that the patients don't have to touch their hand. In the doctor's practice, we've also got hand sanitizers as well, and the girls will disinfect all surfaces regularly 3 times a day to make sure that they clear of viruses. The staff have gloves and they have masks which they wear. I also have a mask which I wear when I'm consulting with patients that I suspect are at risk. And patients are also becoming socially responsible.
Yes.
If they call in and they say to me, we've traveled somewhere and this is what it is, we take
These are the
necessary steps.
symptoms I have.
These are the symptoms that
Yes.
we have. In addition to that, we have a separate area that's outside the practice where we can isolate the patient. I can go to the patient there and decide if the appropriate steps that need to be done, so the patient is not exposed to, the healthy patients are not exposed.
Yes,
to that
it's
COVID-19
almost
patients.
isolating that suspected patient.
100%.
And Doctor, I mean, some South Africans, they're treating this a little bit lightheartedly. They say it's basically a bad flu. And now, what would your response be to those individuals?
So, internationally and thus far, is that only the high-risk individuals that seem to be very, very affected.
Yeah.
So, about 96 to 97% of people that would get the COVID-19 virus will recover probably. So, yes, it is a nasty virus that causes an influenza-like symptoms, which apparently some have said it's like having a flu 20 times, depending on the severity of the disease that they might.
And obviously your own immune system.
Their
Yes.
immune system. Yes. So at one breath, it's not something to panic about, but neither is it something to laugh about, because it can affect everyone, and we all need to play our part in reducing the transmission of this disease.
Of course.
So nothing needs to be taken lighthearted. We need to do every effort that we can to reduce the spread of this virus.
Of course. And in the same breath, not go out in the streets and cause panic.
Absolutely. This panic buying and this hoarding I don't see any sense.
It's not helping anyone.
Not helping anyone.
No, perfect. And now, we spoke about the use of latex gloves in your medical practice, Doctor. Now, I mean, compared to washing your hands as frequently as possible and the use of latex gloves, which one would you say is better?
Washing your hands thoroughly. Soap and warm water, 20 seconds, or using alcohol-based solution with minimum 70% alcohol in it is much better. The idea of a latex glove is meant to be like a once-off thing.
Yes.
So you use it in one particular event, and you
Or one environment.
One environment, dispose it and throw it away. You can't touch one patient with this and go to the next patient and touch.
Yeah, because you'll be taking whatever you've accumulated on the gloves from one patient onto another patient and so forth.
Absolutely.
Or if you're in a public transport, you're taking whatever you've accumulated in one form of public transport onto another form of public transport.
Absolutely,
Yes.
absolutely. Basic hygiene.
Yes.
Washing as much as we can, coughing into our arms. Yeah.
And just being aware and respectful of others around us.
Absolutely.
And now, is it possible that the COVID-19 virus could adapt, could change, like we've seen with the multi-drug resistant TB, various strains of influenza? I mean, is it possible that could happen with the virus?
Thus far, we haven't seen any, but anything is possible.
Yeah.
Remember, it's a virus, like most other viruses can mutate, so we haven't seen anything as yet, but the possibility is there.
Yes, yes. And I mean, if it were to adapt or change in any way, that would obviously affect the research for a vaccine, correct?
Absolutely.
Because medical practitioners or scientists, they will need to re-look at how they're approaching their research.
Absolutely.
Yes.
I did hear something that there's a vaccine that's in the early child phase that might be rolled out in the next year.
Okay.
So hopefully we don't have the virus for next year.
Hopefully it all dies down by then.
Yes.
And now, Doctor, in your opinion, I mean, and your experience, if the cases of COVID-19 were to severely increase in South Africa, do you believe the hospitals in South Africa would be able to cope with the situation? Would it be able to be managed properly?
So currently, the state sector, the public sector, and the private sector have come on board to provide lots of direction and lots of resources to help in controlling this. So yes, we've got great plans in place, and that's policy driven, and it's driven right from the top, from the president. And right now, all hands are on board.
Everyone's working together.
Everyone's working in unison.
Yes.
So yes, we have the ability to be able to handle this. Yes.
If it were to go to such an extreme.
If it had to get to such extreme.
Yes.
So people have to not panic, be calm about it, take the appropriate measures, and work together.
Awesome. And Doctor, in your opinion, what would be the worst case scenario for South Africa?
So the worst case scenario is obviously is that if the transmission rate starts to increase, and then it's going to affect the immunocompromised population, the TB patients and
Yes.
HIV positive patients and our patients with chronic conditions. And at that stage, we're going to start to see increase in the mortality rates.
Yes.
And then that's going to be the biggest
Impact the virus will have.
impact that the virus is going to have on South Africa. And I hope to God it never gets there.
Yes, of course. And now, Doctor, any sort of advice for community members? I mean, we know, we've mentioned that, remain as calm as possible, no unnecessary panic, but any additional advice?
Social distancing, basic hygiene, most important thing. Avoid congregations, avoid group gatherings, make sure that you try to isolate yourself as much as you possibly can to reduce this virus. All attempts must be made by everyone to try to reduce the spread of
Everyone
this
has to
virus.
work together.
Everyone has to work together. Yeah. If anything that people take away, it has to be isolation and hygiene.
And now, lastly, Doctor, I mean, we all know that staying healthy and having a strong immune system is important, no matter what's happening, pandemic or not. And now, I mean, what are some easy and simple methods or ways that people can ensure that they have a strong immune system?
Exercise, eat healthily.
So, healthy body, healthy diet.
Healthy mind.
Awesome. And I mean, and then the consumption of vitamins, is that recommended to community members?
A decent multivitamin is more than enough, but if you eat a balanced diet,
Yeah.
you don't need to take lots of vitamins.
Yeah, because you'll be consuming those vitamins in your daily food.
Absolutely.
No, thank you very much for taking the time to speak to Claxton.
Have a good day.